Hi, I'm Dr. Rajani and I'm talking about the top 3 ways to treat crow's feet. Interestingly, it's the #1 presentation of male patients to our clinics are the lines around the eyes. Now there's several things you can do. I'd be remiss if I didn't talk about prevention. So wear your sunglasses, the sunscreen, and avoid sun exposure are the top reasons. Wash twice a day, avoid pollutants. But what do you do when the lines are in there? They're a little bit deeper. I'm going to give you 3 methods, starting with number 3. The first thing is topicals, and one of the best ones in this area is going to be retinoids, vitamin A derivatives. For some of you, it's retinols that you'll tolerate. Others, it's full retinoic acid, especially if you have skin that's thicker, oilier, or men typically tolerate them a little bit better because they typically have a thicker dermis. So that would be my #1 skincare tip, and you can apply it either morning or evening. Most people apply them in the nighttime, but use your sunscreens. I'll put a video up here of a complete retinol tutorial for you. Number 2, all natural PRF, platelet-rich fibrin. And this is really exciting because we use the liquid form. This is when you draw your blood, you spin it down, and you inject it back using the high concentrated area of platelets and growth factors. We know growth factors from growth factor skincare that I talk about, but sometimes we want to concentrate it all natural from one's own blood. Remember, when you cut yourself, when you need to repair your body, your blood has growth factors, stem cells that are mobilized from the bone that come to heal. And we're using that same healing concentrate, all naturally, no additives, to place back in the eye region. I often call it plasma eyes, and that's the liquid form after we spin the blood of that concentrated area. There's also an up-and-coming form that we use, which is more of a gel or a thicker filler-like substance, all natural, uses your own body, and it can add a little more volume. The PRF that I usually add forms a fibrin clot that lasts for about 7 days. The gel is more towards 3 month plus, but remember, it's not the longevity of those lasting there for a week to 3 months, but the growth factors that are trickling in and your own collagen and goodness that allows the result to last much longer, towards a year or more, depending how you maintain your skin. #1, you can't deny Botox, Botox-like products, so that would be Botox, Dysport, Xeomin, Jeuveau. Those are all botulinum toxin type A, and they are used to stop the muscle movement. So those products go into the nerve cell, stop the release of acetylcholine so that the nerve can't tell the muscle to fire. And if you can't move it, you can't create lines. That's how it works. But it's important to know there's no preventive factor there. So it's not building your collagen. It's not tightening the skin. It's not giving you long-term benefit. However, it can help fade the lines. The problem becomes one day you'll wake up and it won't work because there's too much collagen loss. So it's quick, it's kind of instant, it's in and out. It's about a couple $100, lasts you 3 to 5 months. And that's why people like it, and that's why it's the #1 choice. But I much prefer #2 and 3 because they actually treat the collagen and elastin fibers, and you wouldn't be wrong to do all 3 in combination because we love combinations. I put a complete playlist up here of Botox and Botox-like treatments, and one down here on platelet-rich fibrin, the all-natural way. And in the link in the description below, you'll find the products I love, but also a link to the video on the tutorial for retinols and vitamin A derivatives. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.